Great to have your company, David Foster, with you on Roundtable, actually behind the Roundtable for pretty obvious reasons, and that's the way we will continue, as so many others do, until all of this is over. Now, more men than women are dying with coronavirus, but it's being claimed that women will be the real victims of this disease long after the pandemic is over. Hard-won freedoms, millions of low-paid part-time jobs. These could well be among the first casualties. It's being claimed as the world order is reassessed and reassembled. And who's in the front line? Women.
COVID-19 has become a global pandemic that can harm anyone. Initial data shows that men are more likely to die from COVID-19 than women. For women and girls, the pandemic is having extreme social and economic effects. According to the World Health Organization, women make up 70% of global healthcare workers. They are on the front line of fighting this pandemic and so are more likely to contract the virus. In Spain, cases amongst female healthcare professionals are double that of their male counterparts. Women and girls already do most of the world's paid and unpaid care, and this work has increased in this crisis. Nearly 60% of women on this planet work in the informal economy, earning less, so are at greater risk of falling into poverty. The UN says that during the COVID-19 outbreak, violence against women has intensified in many countries, particularly domestic violence. In France, domestic violence has risen by 30% since the country's lockdown. UN Chief Antonio Guterres has said that COVID-19 could reverse the limited progress that has been made on gender equality and women's rights. What can be done to stop women suffering the side effects of the coronavirus crisis?
Okay, time for us to get talking here on Roundtable. Very pleased to say that later on we'll be hearing from Wanda Wyporska from the Equality Trust and also from Mavic Cabrera-Balleza, who campaigns for women's rights in conflict zones. But first, very pleased to welcome from New York, Sarah E. Hendriks from the UN Women Programme, Director of the Policy Programme and Intergovernmental Division. And from Nairobi in Kenya, we say hello to Dinah Musindarwezo, Director of Policy and Communications at Womankind Worldwide. Look, great to have you on the programme, both of you. Sarah, let me come to you first of all. Do you really believe that women are taking the brunt of all of this?
And I think when we look at past pandemics and crises, what we see is there is no gender neutral crisis, and COVID-19 is no exception. I think when we look at women's lives, we see 70% of women on the front lines as health workers, as nurses, as community care workers right around the world. They are left more exposed to the virus. And furthermore, we see this vast economic impact of the virus likely to impact the lives of women in disproportionate ways, simply because they largely make up 70% of the informal labor force, which is more vulnerable, has less social protection, has less access to health insurance. So absolutely, yes. I think women and girls are likely more vulnerable to the impacts of this pandemic.
Okay, I'm going to read to you something which you probably already know, but our viewers won't. Asa Renier, your boss, she says, we see as so often that women carry countries' well-being on their shoulders. Right now, they are working day and night holding societies together. They do this through healthcare, maternal care, elderly care, online teaching, childcare, in pharmacies, in grocery stores, and as social workers. Are they really holding societies together?
You know, before this crisis hit, the statistics tell us that women and girls worldwide carry about 3 times more of the unpaid care and domestic work than their male counterparts. In some parts of the world, that figure actually skyrockets to 6 or even 7 times higher than men. What we see in the global COVID-19 crisis is a really stark, visible spotlight on this issue, where the realities of quarantine have made the responsibilities for domestic and care work that much more stark, that much more significant. We're seeing women who are taking on care for sick relatives who are now balancing school care and school responsibilities for their children. And I think this reality is increasing exponentially around the world.
Thanks, Sarah. Come back to you in just a moment. But Dinah, tell us a little bit about what your organisation has done and what you're seeing from the perspective of women involved or affected by simply this disease.
So at Womankind, what we are observing is that, as always, the gender issues are not coming at the forefront in the response of COVID-19. And this is not the first time this is happening. It has happened in other crises, but it has also happened in normal times, where we have always had to push for the representation and the voices of women and women's rights organizations to inform decisions impacting them directly or indirectly. And so when it comes to COVID-19, because it is a crisis, actors are in a hurry to act and to respond. And oftentimes, looking at the intersectional gender issues and the human rights-based approach is seen as a luxury. But actually, indeed, we know that without looking at the crisis from a gender lens or from an approach of human rights, it is.
I hear what you're saying about gender equality. I hear what you're saying about human rights. But is this a time to be looking at gender issues? Surely we should be facing this simply as humankind, not mankind or womankind.
I think we have heard from UN Women colleague that this crisis is not neutral and neither is any crisis. And if we look at it, if we approach it from a gender blind angle, then it means that we are not going to be effective. We know that it is the majority of women that are the frontline responding as healthcare workers. We also know that some of the responses actually are going to come from women themselves, from women's group at the community level. This is what we have seen in the Ebola crisis, for example, in West Africa. It had to be women and the youth groups at the community level organizing and supporting those that are being affected, but also taking actions in prevention measures. And we do need that in COVID response. We need to understand how this COVID-19 is impacting on women disproportionately, but we also need to tap on expertise and experiences of women that are organizing at the different levels.
I do understand that your involvement in women's rights, both of you, leads you to sort of always put women at the forefront of what you're doing in terms of your work. But Sarah, let me come to you on this one. We're told we're all in this together. I was suggesting to Dinah that it's humankind, not man or woman, that's fighting this virus. So shouldn't we be approaching this without even thinking of gender?
I think we need to approach the pandemic with the view of taking a courageous and bold approach that drives a better world for everybody, a more resilient, a more sustainable, a more rights-oriented, and a more equal world for all people. And I think that's echoed in the UN Secretary General's call in his policy brief on the socioeconomic impacts of COVID-19. However, in order to achieve both an equal response now in the midst of the pandemic and that vision of more resilient society later, we need to look at the differentiated ways that COVID-19 impacts different people. And I think that's true when it comes to gender. It also is true when it comes to race, when it comes to socioeconomic backgrounds. People experience viruses as well as pandemics in different ways, particularly when we look at the impact. And there are some impacts that are unique and distinct to women. What we're seeing around the world with notable concern is a shadow pandemic that is rising across almost every country. And that is a pandemic on violence against women.
If I may, I'm going to give you some figures. You probably know them already, but I'm not sure that our audience would. As we saw earlier, in France, calls about domestic violence up 30%. In Spain, the emergency number for domestic violence, 18% more calls. Singapore, 30%. United States, domestic violence cases up by 35%. Many people would suggest that the necessary equipment, whether it be funds or people or emotional support, wasn't there before this. Is probably going to be in even greater scarce demand now.
You could be right. I think in some places we're seeing an increased demand for help. In other places, we're seeing women not calling for help because actually that very act leaves them more vulnerable to violence. What we do know is that with almost 4 billion people around the world sheltering at home, and with lockdowns in so many countries, women who were already vulnerable to violence are now fundamentally locked in with their abusers. The statistics that you just highlighted are concerning, but they're also verified by the statistics that we have on vulnerability of violence to women pre-existing COVID, where 1 in 3 women will experience domestic violence in their lifetime, where 1 in 5 women, I think totaling about 243 million women around the world, experienced domestic violence just in this last year.
Mm.
When we think about
Okay, so more money is needed, more resources, and more than ever. Now, we are sort of running out of time in this section. I'm going to come to Dinah once again. Women have a great stake in Africa and indeed around the world, but particularly in Africa, in small businesses and as families, breadwinners. This could be very difficult for them and their dependents.
Yes, indeed, that is true. So some of the countries where Womankind works in Africa, so for example, Uganda, about 70 to 80% of those working in the informal sector are women. They are owning small businesses, but those small businesses have been crucial for sustaining the livelihoods of themselves and their families. But with the social distancing, jobs in the market are closing down, small businesses are closing down if you're not providing essential services. And that means that actually it is women that are going to be impacted mostly. Also in African countries, we have a high number of women that head households, and they are the sole breadwinners for their households. So without any source of income, it means that survival is going to be extremely hard. And
can I ask you this? Africa probably suffers more unjustly and greater than many places in the world from terrible diseases of all kinds. When it comes to COVID-19, coronavirus, are people sort of in Africa, perhaps, or where you are anyway, you can't speak for the whole continent, perhaps looking worldwide and thinking, hang on, we've had to put up with this day in, day out, year in, year out. We'll be okay.
Of course, there has been other pandemics in Africa, and in a way, it prepares the African countries to deal with this pandemic in ways that they have dealt with others. They have dealt with, we know we have dealt with HIV/AIDS, we have dealt with Ebola crisis, we have dealt with the malaria. All those are really deadly crises that have affected people in Africa. But it doesn't mean that in Africa that then we get used to this crisis and that it doesn't raise an.
But there might be a certain resilience there, is what I'm suggesting, and we will just have to wait and see how badly it affects that continent. So many different countries there. Listen, I'm going to have to say thank you for now, both of you. Dinah, thank you very much indeed for your time out of Nairobi, and Sarah, we appreciate the fact very much that you've taken the time to join us from New York. Thank you very much indeed. And let us try and take this just a little bit further. I welcome from New York to Mavic Cabrera-Balleza, Chief Executive of the Global Network of Women Peacebuilders. And in London, we say hello to Wanda Wyporska, Executive Director at the Equality Trust. Wanda, with you in just a little moment, but Mavic, let me ask you first of all, your organisation, I said it's Global Peacebuilders. Tell me a little bit about the work you're doing in a number of different countries around the world.
The Global Network of Women Peacebuilders is an international coalition that works in different countries affected by war or other forms of violent conflict. So we support women's participation in peace negotiations, for example, between the government and rebel groups. And it is very important for women's voices to be heard in those important processes and decisions.
With particular relevance to this current crisis, you're helping to make
Yes.
face masks and other things?
Right. We prepare relief packages that include food items and face masks and isopropyl alcohol, disinfectants, and also what we refer to as dignity kits that contain sanitary pads, soap, toothbrush, toothpaste, that meet the specific needs of women and girls. Often, the relief packages do not contain those, and that's very important considering the reproductive roles or reproductive.
Yes, I understand. And the phone lines in Ukraine, now that's interesting to me.
Oh, in Ukraine, we have a member that is running this phone and text messaging network, and they are specifically reaching out to women who are vulnerable to domestic violence. And that level of violence, as we've seen from police reports and government reports, has spiked because of the isolation. So a number of women are trapped in situations where, they are with their abusers 24 hours a day for days on end, in many countries for over a month now.
Gosh. Well, listen, thank you very much indeed. Back with you, Mavic, in just a moment. Right now, we're going to hear from the head of the UN, the Secretary General, Antonio Guterres, on this subject.
I urge governments to put women and girls at the center of their efforts to recover from COVID-19. That starts with women as leaders, with equal representation and decision-making power. Measures to protect and stimulate the economy, from cash transfers to credits and loans, must be targeted at women.
So there we have the head of the United Nations talking about how important it is to have women at the forefront of any kind of recovery here. But Wanda, let me put it to you. One of the things that you've highlighted with your organization is that over the last 15 years, with all the austerity measures, women have been pushed right to the back of the queue, in your opinion.
Well, absolutely. The cuts that we've seen in the UK, we know that 86% of the cuts have been brought to women because women are used to public services.
I tell you what, Wanda, I tell you what we're going to do, because the sound's not very good. We're going to try and redial you. I'm going to go back to Mavic. Okay, technical problems there. We have lost Wanda. Let's go to Mavic and pick up on the same point. Guterres saying women should be front and center of any recovery, any programs going on at the moment while we have the pandemic. But the suggestion is that women have been pushed to the back of the queue generally the last 20 years, mainly because of austerity.
It's great to hear about Secretary Antonio Guterres' point that women and girls should be up front and center in the response to the COVID-19 crisis. But in order for that to be realized, is that women and girls should be recognized and valued by the governments. They need to be supported in their efforts to respond to the crisis. And as I mentioned earlier, many of the women and girls that we work with in the Philippines, in Colombia, in Ukraine, are on the forefront of the response to the COVID-19 with very little resources, with no personal protective equipment. The government should provide that kind of support in order for them to be more effective.
Have you heard this suggestion, and it may be nothing more than rumor, but it's gaining some ground, that the personal protective equipment you refer to there has mainly been designed by men and often doesn't fit women?
That's true. And from what I see in the United States, for example, like practical considerations like sizes of the personal protective equipment are not making considerations of the different physical makeup of women. But of course, some would argue, oh, we're in a crisis, we cannot deal with that. But that also reflects the lack of vision, the lack of preparedness for crisis in many national governments, especially health institutions. But the good thing is, again, women coming forward, stepping forward in this crisis, when personal protective equipment are not available, they make them. Our partners in the Philippines, in Kenya, are making their own personal protective equipment. They just cannot wait for their governments to respond. While their governments remain indecisive, they are taking action already. But that should be factored in long-term planning and disaster or crisis preparedness of governments.
Okay, assuming that women are regarded to some extent as second-class citizens in a lot of the countries where you find your work as mainly conflict zones, how much more difficult would it be for them in that kind of situation than it would in a normalized society, if you like?
The COVID-19 crisis has escalated the discrimination, marginalization that women experience. And as you know, women have less access and control to economic resources. And now, because of COVID-19, many people, like you have whole families with no sources of income. It's the women who are, responsible for budgeting, ensuring that there's food on the table that are thinking or thinking of creative ways, reaching out to non-governmental organizations, humanitarian institutions, governments to provide resources, food, and medical care to them. The men are just not used to doing all of these things for the family and for the community.
Global network you have there, you can reach influential leaders, presumably in many countries around the world. What do you hope may come out of this, rather than falling back in terms of what women have achieved? Is there any way that their ambitions and their rights could be advanced?
Despite the devastating impact of crisis on everyone, on women, on men, on girls and boys, young and elderly, rich and poor, the crisis can potentially lead to an increase in men's participation in childcare and other domestic responsibilities, especially if the men's jobs allow them for greater opportunities to telework than those of the women. For example, if women are in the medical profession and men are in finance or software development, the women need to go out, and men, will stay in the home and therefore will do more childcare and take on more domestic responsibilities. And we hope that change during the crisis can continue post-COVID and lead to a more gender equal society.
You see, in the first part, we had on Sarah Hendriks from the UN Women's Group, and one of the things that she said, this is not on the program, but one of the things she's written is an effective response to pandemic needs to really look at gender dynamics in a meaningful way, crucial to ensure the availability of sex-segregated data, women not only looking at different rates of infection, but the economic impacts on them as well. That is what she wants. That's what you say you want. Is it likely?
Again, it depends on the political commitment of governments with technical support from the United Nations, from the European Union, from other intergovernmental institutions. Sex disaggregated data disaggregated by age, by socioeconomic status, is very, very important to inform interventions. We can only do effective intervention, effective crisis response if we have reliable data. All of our actions should be guided or informed by facts and science. There's no alternative to that. So I reinforce Sarah Hendriks' point.
And domestic violence, on another tack in the UK, police say drug dealers are now standing out. Do you think domestic abusers are standing out because we are reporting on this a great deal more than we would otherwise? Or do you think it has actually gone up considerably, the incidence of domestic violence?
It has gone up alarmingly. And that is because women who are already in abusive relationships are trapped in their own homes, are having to live with their abusers 24 hours a day and for over a month now. And here in New York, the stay-at-home order has been extended until May 15. So can you imagine if you're in an abusive relationship and you're stuck with that you're the perpetrator of violence for days on end? What will you do? Plus the fact that domestic violence support institutions are already overwhelmed by the spike in the number of cases.
Yeah, we see Andrew Cuomo, the mayor of, or the governor of New York State, on the news pretty much every day. Has he made an effort to make sure that the women, particularly where you live, are going to be perhaps protected in a way that they've not been before?
I admire Governor Cuomo very much in his very timely and hands-on response to the crisis. But unfortunately, I have not seen actual increase in the assistance provided to women victims or those who are vulnerable to domestic violence. I know he has mentioned it
so
a couple
good
of
words.
times. Yeah,
Yeah.
exactly.
Fine
Good
words,
words
but
have
not
to be
necessary.
translated into reality.
Mavic, thank you very much indeed. That's Mavic Cabrera-Balleza, Chief Executive of the Global Network of Women Peacebuilders. We say thank you too to Wanda Wyporska. We had to say goodbye to her because of the quality of the line, and to our other guests on this program. Thank you very much indeed, and thank you very much indeed for watching this edition of Roundtable. From me, David Foster, not from the usual location, and we don't know for how long, but still interesting to be with you. Thank you very much indeed. See you soon. Bye-bye.